What's up, guys? Gonna talk about eyebrow piercings. Alright, so, as you all know, I got mine pierced actually a week ago today. So it's been 7 days since I've had it today. It's my 7th day of having it. So there's two options to get. You can either get like the full ring, it's like semicircle, or you can get what I got. It's not a full circle, it's just a little curve in the barbell. It's called a curved barbell, I think, but I'm not an expert on this. I'm just telling you what I've got done, and you can see it's not infected or anything. I cleaned it a lot. That top one. But I cleaned it a lot. Like, I clean it 3 to 4, probably 4 times a day. Now, how I clean it, I take you want to use any kind of antibacterial or microbacterial soap, and you want to take what I do, I'll show you another video how I clean it, but I got this dial foam stuff which worked really good, because all you gotta do is I squirt it right on the Q-tip, then I just get all around the ball, on top, inside, both balls, just get them nice cleaned out, let the soap like sink in, let it set in, and then just take my head or my eyebrow under the sink and just let it rinse off, and just let it kind of, rinse all the soap off. And I take a makeup pad, how girls remove their makeup, take one of those and I just dry it off. And then after that I take, I got this bacitration infection ointment, and just keep it from getting infected. It's like I don't know what it does, but it's bacitration, that's what I call it. But anyways, so it comes in this little tube, and you use that for the first week. So today's my last day using that, and then you put it on there pretty good. I'll show you guys all this probably after my tutor leaves, because I'll be going out for the day. But after that, I'll do it. I'll clean it before I go. So yeah, I just gotta take care of it. Now, before you get it, it doesn't. For me, it didn't hurt. For me, it didn't hurt at all. All they do is they take a clamp. It looks like a pair of scissors, but it has 2 clamps in them. They kind of clamp. First off, you can get it wherever you want it at, but I asked her where she think it'd be best to put it at, because you don't want it too far down where your eye can see it out of your peripheral vision, and you staring up at it what is that? That bugged the crap out of me. You don't want that. So she take a marker and they put the 2 little dots right there. Then if it looks good to you, so you can go ahead and do it. That's why I said, alright, looks good. They take the clamp, looks like a pair of scissors, but it has 2 little clamps, and they kind of clamp the area. It doesn't hurt, it feels like somebody's rubbing your forehead, what it felt like to me, and they just kind of take it up and down and move it around. Then they take the needle, it's it feels like a shot, doesn't even hurt. If you're getting a shot at the doctor, it doesn't even hurt that bad. They just, poop, feel a little pinch and it's over. Then they just take the ring, slide the needle out, put the ring in as they're sliding it out, and then they put the balls on, or the spikes, whatever you want to get. But I recommend starting out with just the balls, just because it's just easier to clean. It's just more, you know what I mean? I don't know. I think it's easier to clean. It's just for a starter, you know what I mean? But I might go to Spikes one day to try it. So really just want to make a quick video on that. But okay, so now if you're worried about it, the worst thing that happened with this, they're not going to hit your eye. They're professional. Get it done by a professional. I recommend if you're going to get this done, any kind of piercing or tattoo done, recommend Red Octopus Tattoos. Actually, I'll flip it like that. Well, you can't see it because it's backwards, but Red Octopus Tattoos, great. They got one in Prince Frederick, Landover Hills, and Morningside. So if you live around the Maryland, D.C. area, good place to go. Red Octopus. That's where I got mine done at. So yeah, that's basically it. And really just follow whatever your piercer tells you to take care of it, whatever they say. They gave me this little instruction paper. What they said: Red Octopus and body piercing aftercare instructions. Eyebrow wash piercing with antibacterial soap to remove all crusties from skin and jewelry. Rinse completely. 2. Apply a small amount of bacitration with a Q-tip. Work ointment in by moving jewelry back and forth. So you just want to kind of get in the ball and move the jewelry back and forth. Then you never pick the crust or pull it off the jewelry and break the crust. It's gonna, I don't know why, but just don't wash your hands before you touch your jewelry or even clean it. Repeat it 3 to 4 times a day or as needed. Always wash your hands before touching your piercing. So that's really it. Also, if it gets infected, let me tell you the worst thing that can happen with this. Worst thing that can happen is it gets infected or it rejects. Now, rejects means the piercing pushes itself out. It'll come out with your skin. That's what rejecting means. Infection just when it gets red and it's just infected. Now, the best way to treat an infection, from what I've heard and what I've learned from Piercer and other people, they said you got to clean it really good because you're going to want to take the ring out, but you don't do that because then it creates an abscess. That's basically like a big hole, and it gets in the wound. Then you're going to have a scar there. So it's going to hurt. You're going to want to take the ring out, but don't take it out. It's going to close up, and it's just going to be a nasty little scar there. So leave it in. You clean it more than what you usually do, and then after you clean it, you take sea salt and water, not table salt, because there's iodine in it and it's irritant, so you don't use table salt. Use sea salt or Epsom salt, and then you put it in water, boil it, let it cool, and take a napkin or whatever you're using for paper towel, toilet paper, makeup pads, whatever you're using. Soak it in there, and then put it right on the piercing, and then leave it there for about 10-15 minutes, and it'll draw all the pus and all the blood and all the bacteria in it out of it. So that's how you take care of it infected. And I'll put another video up on how to clean it if anybody's wondering about it. But just things to think about if you're thinking about getting it done. I mean, I wouldn't get any other piercing besides this. I mean, I was thinking about getting an earring piercing an earring to go with it, but I decided that's just gay, so I'm not going to do that. But you know, not crazy. You know, doesn't look bad. Just a little ball. It's not too bad. But you know, if you're really going to think about any other kind of jewel for this, I mean, you got the circle, like the semicircle, it's like that. Mine is kind of like just a little curve in it, kind of just enough to get it through the other hole. That's kind of what I like. Then it looks like this. If you get the ring, the ball is a little more popped out more a little bit. And the barbells, don't do that. For guys, don't get barbells. It just looks crazy. And nobody's going to hire you to get a job. So, that's really it, guys. I will post a how to clean it video. So, alright guys, peace.